we've been seeing a huge uptick in overdoses as well. It's due to drug contamination from metetomidine, which is a anesthetic used by veterinarians. So it's been really awful, and it's really difficult on the front lines for all the folks that are helping each other in the community. We're basically the frontest of the front line, so it's community members helping each other and friends
Hmm.
helping friends in overdoses. So it's very difficult situation.
And you were doing drug testing on site. I guess, what you're coming across is metomidine, the animal tranquilizer. How
Yeah.
frequently are you coming across it?
It's right now it's really in the drug supply. So the drug supply is fentanyl, but sometimes it's benzodiazepine. It just depends on what's in the drug supply at the time, and I guess what people can find to put in the drug supply is a filler or just an additional agent within the drugs. So
Right.
it's ever changing, but it'll never go back to the way that it was. It's just fentanyl is just so easy to produce. It's just something that we're going to have to live with and figure out how to deal with.
The latest data, Sarah, from the BC Coroner Service shows nearly 1,400 unregulated drug deaths this year so far. That's as of September. The trend, however, even with that number, is going down. I mean, we saw 2,300 deaths over all of 2024. The year before that, about 2,600. It does look like we're on a little bit of a downward trajectory, given the upward trajectory we've been on for years. What would you attribute this, modest increase in the number of deaths? What would you attribute that to?
I would say education, using overdose prevention sites, education, people using together, never using alone. I think education has a lot to do with it. Young people knowing how toxic the drug supply is when they go out to party. If someone offers them a pill, they know that it could be contaminated and can kill them. So I think people also have learned. We've done a lot of education around how to use naloxone. I think the education is really helping. Um, so I think young people being educated. Um, I think that has a lot to do with it. In using overdose prevention sites as well. People don't die at overdose prevention sites. Um, we give information around what the contaminated drug supply is, so people know. They know to use a little. We can, before using a lot. We educate people on being safe. We help people now get into recovery. We have recovery navigators on site. There's a lot of good changes happening right now in terms of just being able to get easier access into detox and detox on demand at overdose prevention sites. So there's a lot of really, things happening that are positive and helping people, and we just need to continue that. It's still very urgent, and obviously, overdoses. At the rate that we're seeing them is a very challenging situation especially for the peers. We tend to be the frontest of the front lines in a lot of ways in the downtown east side. By the time the ambulance and the paramedics get there, like our folks have 95% of the time people are conscious again and not having to go to the hospital. But yeah, we definitely need more
Yeah.
spaces indoors for people to go.
It has been, as I said, 9.5 years since the province declared an opioid crisis in BC. Do you see us getting any closer to the underlying issues that need to be addressed to make the kind of progress we need to make?
I think education is really important, and I think getting people who want to get into recovery. I think building housing. Everybody wants to live a life where they've got a job, they've got housing, they've got a family, they've got community. Um, uh, Helping people with mental health. I think like we've figured out what doesn't work and
Hmm.
what does work, and I think it, working with the government I mean, it's still very urgent, as you can see, and it's urgent, and the fire department and the ambulance and the VPD and all of us are still in the middle of an emergency. So it's still an urgent situation, but I think we're seeing what's working. It's great to have Larry Campbell uh, involved
I was just
now.
going to ask you about that. He is
Yeah,
there to liaise between the front line and the province. What difference has
yeah.
that made?
Well, he's got a lot of experience, obviously, but being a senator, being a mayor, being a coroner. So he's meeting with everyone and try to put all the pieces together to see what's working and what's not working. And so we're very grateful to have him around and have
Mm,
his expertise around, and just fresh, it is sort of fresh eyes because he's been, not in the downtown east side for a long time. So
yeah.
he's able to come in and see what we're doing to, give advice on what he thinks. So I'm really looking forward to seeing, what he comes up with.
Sarah, it's good to hear you this morning. Thank you so much for the time as always, and we'll talk again, I'm sure.
Okay, thank you.
Okay, take care. That's Sarah Blyth, Executive Director of the Overdose Prevention Society.